Now, the government is set to roll out the National Social Health Insurance Fund starting the 1st of July as part of its universal health coverage agenda. Now, speaking today in Nairobi when she officially opened the two-day National Cancer Summit, Health Cabinet Secretary Susan Nakhumicha said the move will ensure that Kenyans from all walks of life get access to better health care. On his part, Kisumu County Governor Professor Peter Anyang Nyong'o said that the Cancer Summit provides an opportunity for Africans to join hands and redesign cancer interventions for its people.
Cancer is the third leading cause of death in Kenya. In 2020, 42,000 new cases were reported in the country, with 27,000 cancer-related deaths. Health Cabinet Secretary Susan Nakhumicha is calling for concerted efforts for response to the growing cancer burden in Kenya by stakeholders.
I wish to reiterate our commitment as the Minister of Health, working with stakeholders to deliver strategies which will not only transform the cancer response, but improve quality of life and bring prosperity to Kenya.
The CS said the government is working towards changing the Nation Health Insurance Fund to National Social Health Insurance Fund to ensure it's more inclusive.
We are starting the social one, that we focus on primary and preventive health care. And for cancer, we are saying once we do proper screening at the community level, then we increase those that come up and go up for treatment. So we want to have the social one so that everybody is taken care of at the base. You are screened at the community level so that it is discovered right there. Then you are referred upwards the referral system to level 3, 4, and 5 where you can be taken care of.
Kisumu County Governor Anyang Nyong'o, who spoke on behalf of Council of Governors Chair Anne Waiguru, said the prevention services should be at the center of health services, noting that county governments were working towards expanding cancer centers that will provide screening services for early detection.
We need to continue investing to ensure that everyone who gets cancer is identified at the earliest opportunity and treated at the earliest possibility. It is known that discovered early, cancer is treated like any other disease.
We only have 63 cancer centers that are only restricted, or rather, they are in only 17 counties. 47 out of 18 counties, that tells you that we have a total of over 20 counties that have no idea and they have no space, even in their plans, on how they can be able to have their patients diagnosed with cancer unless they go to the next county or they come to Nairobi and other places. So there's a lot of work to be done.
Acting Director of Africa Centers for Disease Control and Prevention, Dr. Ahmed Ogwell, called on the government to strengthen institutions that handle cancer, train healthcare workers, including community healthcare workers, invest in domestic manufacturing of resources, as well as partnering with other stakeholders in order to reduce the growing number of cancer cases.
Although breast cancer and cervical cancers have been documented as the leading cancers on the continent amongst women and prostate cancer amongst men, the range of cancers is large, and we must at all times design our strategies and responses to accommodate the large range of cancers here in Kenya and as well as on the continent of Africa.
The summit that ends on Saturday aims at reviewing the status of the cancer response in the country and building policies and capacity among stakeholders to enhance the response and management of the disease.